We've all been there, right? You wake up, you look in the mirror, and your eyes are just puffy and irritated. You know that feeling.
Oh, yeah.
But what if it's like more than just a bad night's sleep? What if it's something called chemosis?
Chemosis.
Yeah, chemosis, exactly.
I know it sounds a little intimidating.
It does. I thought it was like a fancy cheese or something at first.
Yeah.
But you've asked for a deep dive on it, so let's get into it. What exactly is chemosis?
Well, it's all about the conjunctiva. That's that clear layer that covers the white part of your eye. And when that decides to, swell up.
That's when you get chemosis.
Exactly.
So we're talking about swelling, but not necessarily infection.
Right. And that's a key distinction.
Okay, so then let's break it down. Joining me to shed some light on all this is our in-house expert. Welcome.
Thanks for having me. Happy to be here.
So chemosis. For someone who's hearing this for the first time, how would you explain what's going on?
It's basically when the conjunctiva, that clear layer we talked about, gets irritated and starts to hold extra fluid.
Like a blister, almost.
Yeah, kind of. It can make your eye look watery, bloodshot, even feel like something's stuck in there.
Ugh, I hate that feeling.
It's definitely not pleasant, and that's actually a pretty common way people describe it, that feeling of pressure or like a foreign body in the eye.
So how is that different from, say, conjunctivitis? Like, most people know that as pink eye, right?
Yeah, good question, and it's an important distinction. Conjunctivitis is inflammation, often from an infection. Chemosis is specifically the swelling itself.
So they can happen at the same time, but they're not the same thing.
Exactly, and that's why it's so important to figure out what's causing the swelling, because that's going to determine how you treat it.
And when we're talking about causes, this is where it gets interesting, because the list is longer than I expected.
Yeah, it really runs the gamut.
Give us the rundown.
We're talking allergies, infections, both bacterial and viral, then things you might not expect, like thyroid problems, reactions to medications, even complications from eye surgery.
Whoa, hold on. Eye surgery can cause this too.
It can in some cases, which is why seeing a doctor is so important if you're dealing with chemosis that's just not going away, or if it's really severe.
Okay, so definitely not something to just ignore then. You really need to get to the bottom of what's causing it.
Exactly. It's not just about treating the discomfort. It could be a sign of something else going on in your body.
So let's say you're, dealing with some eye stuff. How do you know if it's actually chemosis we're talking about?
Well, we touched on that feeling of having something stuck in your eye. That's a big one.
Okay, yeah, that's never a good sign, is it?
Definitely not. And you'll probably also have a lot of tearing, like your eye's trying to flush something out.
Makes sense.
And blurred vision, too, kind of like a film you just can't blink away.
So not just your typical, I need more coffee kind of blurry vision.
Right, exactly. It's more persistent, more noticeable.
And I'd imagine allergies would play a big role here, right? Since those can make your eyes watery and itchy anyway.
Absolutely. Allergies are a huge factor when it comes to chemosis.
So what's actually going on there? Why do allergies do that to our eyes?
Basically, when you have an allergic reaction, your body releases histamine, which is supposed to help fight off whatever it thinks is attacking you.
Right, the body's defense system.
Exactly. But sometimes that defense system goes a little overboard, and that histamine can cause the blood vessels in your conjunctiva to, dilate and leak fluid.
Hence the puffiness and swelling.
Exactly. Now, the good news is, with allergies, that kind of chemosis usually goes away on its own or with some over-the-counter allergy meds.
So nothing too serious.
Usually not. But here's the thing. If you're ever having really intense allergy symptoms like trouble breathing, your lips or tongue swelling up, your heart racing, and you've also got the eye swelling,
That's when it's time to worry.
that could be anaphylaxis, which is a really severe allergic reaction. It's rare, but it's better to be safe than sorry, right?
Always better to be safe. So you mentioned earlier that even surgery can sometimes cause chemosis. I'm still kind of hung up on that, to be honest.
I know, right? It seems counterintuitive.
It does.
Yeah.
So remind me again, what kind of surgery are we talking about here?
Well, one example is blepharoplasty.
Okay. You're going to have to break that one down for me.
It's basically a procedure to fix droopy eyelids.
Oh, right. For like cosmetic reasons, usually.
Often, yeah.
And that can cause your eyes to swell up.
Sometimes, yeah. It's not super common, but it's a possible side effect. Anytime you're having surgery, there are risks, and this is one of them.
So something to keep in mind if you're considering that kind of procedure.
Definitely something to discuss with your doctor beforehand.
Okay, so we've talked about what causes chemosis, how to recognize it, but what about treatment? what do you actually do about it? So how do you actually treat it? What are the options?
Well, it really all comes back to what's causing it, right?
Right, like we were talking about before, it could be so many things.
Exactly. So the first step is figuring out the root cause, and then you can target the treatment.
Makes sense. So, like, if it's a bacterial infection?
Antibiotics, yeah. If it's allergy related, antihistamines, either eye drops or oral medication, usually do the trick.
Okay, so pretty straightforward in those cases.
Yeah.
But what about, like, the post-surgery chemosis we were talking about? What do you do about that?
In those cases, it's often about managing the inflammation and discomfort while things heal.
So, like, cold compresses, that kind of thing.
Exactly. Cold compresses, lubricating eye drops, sometimes even steroid eye drops to help with the swelling.
And that usually does the trick.
Most of the time, yeah. Chemosis, even after surgery, tends to resolve on its own with a little time and the right care.
That's good to know. But I'm sure there are some cases where it's more serious, right? Where you might need to do more.
Yeah, of course. If the swelling is really severe, like it's causing vision problems, or if it's related to something more serious going on in the body.
Then you might need to bring out the big guns.
Potentially, yeah. But the key is communication. Talking to your doctor, being honest about your symptoms, that's the best way to make sure you're getting the right treatment.
Absolutely. And on that note of being proactive, I wanted to circle back to something you mentioned earlier about contact lens.
Oh, right, yeah.
I know. We've all heard it a million times. But those stats you shared about improper contact lens care, those were kind of scary.
Yeah, it's easy to forget how important those little things are.
Like, what specifically are we talking about here? Just to remind everyone.
Washing your hands before you touch your lenses every single time. Cleaning your lenses properly with the right solution, not just topping them off, and then storing them correctly when you're not wearing them.
Those things make a difference.
A huge difference. You're much more likely to get infections, ulcers, even chemosis if you're not careful with your contacts.
So it's worth it to just take those extra few minutes, you know?
Absolutely. Your eyes will thank you for it.
Well said. Well, I think that about covers it for chemosis.
It's a lot more complex than people realize.
Right. I know. I learned a lot today, that's for sure. And I hope our listeners did too.
Me too.
And remember, folks, we're not doctors here.
Definitely not.
So if you're having any problems with your eyes, don't just self-diagnose. Go see a professional.
Good advice.
All right. Until next time, everyone, stay curious.